19-year-old Arabic man Ammar Faraj was involved in a motorbike accident and sustained an extensive brain injury and has now been declared brain dead. The family has been informed and they have requested that he is considered for organ donation, as his cousin is a kidney transplant recipient. The organ donor coordinator and the hospital senior nurse of organ and tissue donation are now in the process of completing a detailed questionnaire on the patient's lifestyle and behaviour. They are having the discussion with Ammar's parents, friend and girlfriend.
Has Ammar ever travelled outside of Australia?
هل سبق لعمار سافر خارج استراليا؟
أي سافر، هو يحب يسافر، يحب يكون برا، سافر مرة لمصر وسافر اليونان.
Yes, he has traveled outside Australia. He likes traveling outside Australia. He's been to Egypt, he's been to Greece.
Mm-hmm. Has Ammar ever had Ross River fever or malaria or dengue fever or any of the tropical diseases?
هل أصيب عمار بحمى مثل ملاريا أو يسموها روس ريفر فيفر، حمى نهر الروس، أو الدنجي أو الظنين نسميها، أو حمى كيو، أو أي من الأمراض الاستوائية؟
اكو امراض احنا ما متداوله
يعني ملاريا سامعين بها بس هو ما مصاب بالملاريا، بس باقي الامراض ما نعرف.
ما فهمنا.
Sorry to say that we've heard of malaria, but we don't know about the other fevers you've just mentioned. Really, we haven't heard about them. Can you just elaborate more on that, please?
They're all tropical diseases that we see spread by mosquitoes.
Raising difficult topics relating to personal, sexual, and lifestyle issues must be made, and it may cause some discomfort. However, it is essential that these questions are asked to ensure that transplant recipients receive organs with minimal risk of transmissible diseases.
Now, the next few questions can be quite awkward. If you've ever donated blood, they're similar to the sorts of questions they would ask at that time.
Yeah. راح أسأل كذا سؤال، قد تبدو الأسئلة غريبة، لكن وإن كان أحد منكم سبق وأن يعني حصل على دم أو حصل له نقل دم، ممكن هذه الأسئلة تكون معروفة عنده، يعني السمع لها من قبل.
To the best of your knowledge, has Ammar ever injected or snorted or inhaled drugs?
على حد علمكم ومعرفتكم، هل سبق لعمار أن تعاطى مخدرات عن طريق الحقن أو الشم أو الاستنشاق أو الشم؟ Not by injection or inhale or anything. That's really far from him.
Do either of you know any other information? You've obviously been out with him, socialised with him.
Would I say so now?
نعم تعاطى مخدرات.
شنو تعاطى؟ نعم.
What years he's had drugs? No.
He has done drugs.
أرجو أن ما يكون خلل بالترجمة. شنو قالت؟
Yeah, I hope there's no mistranslation. What did she say exactly?
He has done drugs.
نعم تعاطى مخدرات.
لا تكذب أبدا، مستحيل يكون ابني أنا.
No way, impossible. You know, never my son had drugs.
He has.
No. ومنين تعرفوه أنتم؟ قلت لي زين هو ابني، شلون راح تعرفوه أنتم؟
How would you know him really that good to say that?
I was his best man. I was there with him.
أنا كنت وياه، كنت أفضل صديق له.
لا مستحيل، ابني ما ياخذ مخدرات نهائيا.
My son would never have or had drugs. No way.
أنتم دا تكذبون هسه، لوش دا تكذبون؟ أكيد عندكم فد شيء.
You're lying. Why you're lying? You have something really to hide.
يعني لأنه صار به حادث الآن أصبح هذا الكلام. ليش ما قالوا من كان هو صديقهم إذا كان يحبوه فعلا؟
Now because he's involved in an accident, they're saying things. When he was okay, why didn't say such things about him?
I think this is a terribly sad situation, and I think it's all very stressful, and maybe we should just take this opportunity to take a short break.
باعتقادي هو الوضع شوية محزن يعني وكيف هو الوقت الملائم انه احنا ناخذ استراحة قصيرة.
ما محتاجين اي استراحة. انا اعرف ابني كل سنة، انا اكد لك انه ما ماخذ ابدا اي شيء من
I can
هاي.
assure you that he never had drugs in any way.
ابدا ما ماخذ.
He never had a drug.
ما اعرف ليش هي قاعدة تكذب.
I don't know why she's lying.
احنا يعني جوابنا الاخير انه ابننا ما عنده هذا الشيء نهائيا.
Answer that my son never had drug. That's it.
هذا بدون استراحة بدون اي شيء.
Without a break, without taking a break or anything. That's about it. Whilst the healthcare professional is responsible for assessing group dynamics, on occasion, the interpreter may become aware of differing opinions and understanding amongst family members. It is important the healthcare professional is made aware of these discrepancies.
To the best of your knowledge, has Amar ever injected or snorted or inhaled any drugs?
على حد معرفتكم وعلمكم، هل سبق وان عمار تعاطى مخدرات عن طريق الحقن او الشم او الاستنشاق؟ possible not by inhale or anything. It's our son and we know him better. Never in his life, never. He was a good boy. Impossible he does such things.
I think now might be a good time to take a break, and we'll all come back together again in half an hour.
أتصور هو أفضل وقت لنا ناخذ استراحة قصيرة ونرجع نكمل الموضوع بعد مدة قصيرة.
I just thought this break time might have been a good opportunity to talk to you both. I sense that you might have some more information about Amar and any drug use. I'm just wondering if you can tell me that information.
We can trust you.
Absolutely. Anything you say will be kept confidential, and you need to know that I'm not here to judge Amar or anything that he may or may not have done. It's just important that I get as much information as possible so that we can have the best outcome for donation and that we can minimise any risk for transplant recipients.
As Amar was young and fit, he was able to donate all organs. Unfortunately, he was unable to become a tissue donor due to the recent acquisition of a tattoo and our inability to clarify the extent and frequency of his drug use.